All India Radio presents Morning News. Good morning, I'm Sunil Verma and with me is Subhadra Ramachandran. The headlines. Prime Minister Narendra Modi to participate in meeting of European Council today as a special invitee. Government to induct 8 lakh qualified Ayush professionals for clinical management of COVID-19. India says TRIPS waiver will enable a rapid scaling up of manufacture and timely availability of affordable COVID-19 vaccines. Indian Air Force and Navy step up efforts to ferry oxygen and medical supplies. Calcutta High Court seeks report from West Bengal government over post-poll violence. US calls upon WHO to invite Taiwan for upcoming World Health Assembly as an observer. And in sports, Indian wrestler Seema Bisla qualifies for Tokyo Olympics. As the number of COVID cases is on the rise, we appeal to our listeners to take all precautions and all those above 18 years of age to get vaccinated without any hesitation. The vaccination for persons of age between 18 and 44 has begun at designated facilities. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, and focus on hand and face hygiene. And now the news. Prime Minister Narendra Modi will participate in the meeting of the European Council today as a special invitee. The India-EU leaders meeting is being hosted by Prime Minister of Portugal, António Costa. Portugal currently holds the presidency of the Council of the European Union. More from our correspondent.
Prime Minister Narendra Modi will participate in the virtual meeting along with the heads of state or government of all the 27 European Union EU member states. The EU plus 27 have met in this format only once before with the US President in March this year. The leaders will exchange views on the COVID-19 pandemic and healthcare cooperation, fostering sustainable and inclusive growth, strengthening the India-EU economic partnership, as well as regional and global issues of mutual interest. The India-EU leaders meeting is an unprecedented opportunity for discussion with all the leaders of the European Union member states. It is a significant milestone and will further build on the momentum witnessed in the relationship since the 15th India-EU summit in July last year. Anupam Mishra, AR News, Delhi.
India has said the TRIPS waiver will be an important step for enabling the rapid scaling up of manufacture and timely availability of affordable COVID-19 vaccines and essential medical products on a global basis. This was stated by Foreign Secretary Harshvardhan Shringla while addressing the UNSC high-level meeting on maintenance of international peace and security, upholding multilateralism, and the United Nations-centered international system. He said, India has worked with South Africa and other partners in the World Trade Organization to seek a relaxation in the norms of the TRIPS agreement to ensure quick and affordable access to vaccines and medicines for developing countries during this pandemic. The Foreign Secretary added, New Delhi has provided COVID-19 vaccines, pharmaceuticals and medical equipment to more than 150 countries across the world over the past 1 year. The Foreign Secretary said, at the core of India's call for reformed multilateralism lies the reform of the UN Security Council, reflective of the contemporary realities of today. He said, the multilateral institutions must be made more accountable to their membership. They must be open and welcome a diversity of viewpoints and be cognizant of new voices. He added that the Council must be made more representative of developing countries if it is to continue to engender trust and confidence in its ability to provide leadership to the entire world.
The 9th Foreign Office consultations between India and Colombia was held through video conference yesterday. It provided an opportunity to comprehensively review the whole gamut of bilateral cooperation, including political, trade and economic cooperation, agriculture, space, energy, health and pharmaceuticals, tourism, information technology, education, development partnership, sports and culture. Both sides underscored the need to intensify dialogue in these areas through the established bilateral dialogue mechanisms. External Affairs Minister Dr. S. Jaishankar, along with his delegation, returned to India from UK after testing negative for COVID-19. The minister, who was on a 4-day visit to London to participate in a meeting of foreign ministers of G7 countries, he had to attend the meeting virtually after he was informed about exposure to possible COVID-positive case. In a tweet, Dr. Jaishankar said, "It was good to be back home and all of them had tested negative for COVID-19. He added that these are difficult times and false alarms do happen.
The United States has called upon the World Health Organization Director General, Tedros Adhanom Ghebreyesus, to invite Taiwan to participate as an observer at the upcoming annual meeting of World Health Assembly (WHA), saying there is no reasonable justification for Taipei's continued exclusion from the forum, asserting that global health and global health security challenges do not respect borders nor recognize political disputes. U.S. Secretary of State Antony Blinken said that Taiwan offers valuable contributions and lessons learned from its approach to these issues. He added that Taiwan offers valuable contributions and lessons learned from its approach to these issues, and WHO leadership and all responsible nations should recognize that excluding the interests of 24 million people at the WHA serves only to imperil, not advance, our shared global health objectives. The WHA is set to hold its 74th annual meeting virtually from Geneva, Switzerland, from May 24th to June the 1st. Niti Aayog member Dr. V.K. Paul has said that mucormycosis, known as black fungus, affects those people who are suffering from diabetes. Reacting to reports of mucormycosis or black fungus amongst the COVID-19 patients, he said, the infection affects only those who have a high blood sugar level. Dr. Paul said it is a fungus that breeds on wet surfaces and it is very uncommon to happen amongst patients who do not have diabetes. He asked the people to control their sugar level to prevent this disease. Dr. Paul said overuse of steroids must be avoided as it can create ill effects.
The government has issued advisory for induction of trained Ayush human resources for clinical management of COVID-19. Ayush Ministry said that a pool of 8 lakh qualified Ayush professionals will become available for COVID-19 duties. The decision to deploy Ayush professionals at the front line of the COVID-19 war is in continuation of the decisions taken a few days back to boost the availability of medical personnel to fight COVID-19. The ministry said Ayush doctors are institutionally qualified professionals, well trained in various aspects of medical care. The ministry added the All India Institute of Ayurveda, New Delhi, which functions as a COVID-19 care center, is efficiently managing COVID-19 cases at present. The ministry will support states, union territories in the development and conversion of Ayush hospitals to COVID-appropriate facilities. This will add 50,000 beds, 750 Ayush hospitals, and 86 clinical facilities to the COVID-19 infrastructure. Considering the current situation in the wake of resurgence of COVID-19, the state and UT governments have been advised to reach out to all qualified Ayush practitioners and persuade them to join the COVID-19 workforces in this hour of need. The services of these Ayush doctors can be utilized in the management of COVID-19 at appropriate levels. The deployment of Ayush physicians, postgraduate students and interns in clinical setups for COVID management may be done under the supervision of medical doctors and specialists. In view of COVID-19, the government has relaxed the provisions of Income Tax Act. Now, all hospitals, nursing units, dispensaries and COVID care centers will be able to accept cash over 2 lakh rupees from the patients. Patient and the payee will have to submit their PAN and Aadhaar for such payments. The relaxation has been granted between 1st of April to 31st of May this year.
Central Board of Secondary Education, CBSE, has launched a new mobile application for psychosocial wellness of students and parents. The new app, namely CBSE Dost for Life, has been designed for students of classes 9 to 12 and it can be used for counseling sessions from 10th of this month. Making a departure from the existing practice of counseling through toll-free number across the country, the board has designed this facility for the ease, convenience and utility of students and parents within the safe home environment. Through this app, live counseling sessions will be conducted free of cost on Monday, Wednesday and Friday by the trained counselors. Principal Scientific Advisor to Government, Professor K. Vijay Raghavan, has said that India may manage to dodge the third wave of the coronavirus if necessary and strong measures are taken. Earlier, he had said that the third wave is inevitable. Dr. Raghavan said that the emergence of a third wave depends on how effectively the guidance is implemented at the local level, in the states, in districts, and in the cities across the country. He said that the guidance is about precautions, surveillance, containment, treatment, and testing. Dr. Raghavan asserted that the insidious asymptomatic transmission can be stopped if these guidelines are followed properly. He said that even though it may sound difficult, it can be done.
You are listening to the morning news on All India Radio. A reminder of the headlines before we move on. Prime Minister Narendra Modi to participate in meeting of European Council today as a special invitee. Government to induct 8 lakh qualified Ayush professionals for clinical management of COVID-19. India says TRIPS waiver will enable rapid scaling up of manufacture and timely availability of affordable COVID-19 vaccines. Indian Air Force and Navy step up efforts to ferry oxygen and medical supplies. Calcutta High Court seeks report from West Bengal government over post-poll violence. U.S. calls upon WHO to invite Taiwan for upcoming World Health Assembly as an observer. And in sports, Indian wrestler Seema Bisla qualifies for Tokyo Olympics. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
The meeting of the leaders of the European Union and India is a moment of profound geopolitical significance. By bolstering the dialogue between the world's two largest democratic spaces, it will provide new impetus to our partnership with a positive effect on international trade and investment. This was stated in a joint op-ed by Prime Minister Narendra Modi and the Prime Minister of Portugal, António Costa, written ahead of the pivotal India-EU Leaders Summit today. Indian Air Force and Navy have intensified their efforts to aid the civil administration in tackling the current COVID-19 situation by ferrying oxygen containers and medical equipment. The C-17 aircraft of Indian Air Force have conducted 400 sorties from within the country, including 351 to airlift 252 oxygen tankers of total capacity of 4,904 tons. The cities covered were Jamnagar, Bhopal, Chandigarh, Panagarh, Indore, Ranchi, Agra, Jodhpur, Begumpet, Bhubaneswar, Pune, Surat, Raipur, Udaipur, Mumbai, Lucknow, Nagpur, Gwalior, Vijayawada, Baroda, Dimapur and Hindon. The Air Force aircraft also conducted 59 international sorties to airlift 72 cryogenic oxygen storage containers of 1,233 tons. The containers and cylinders were procured from Singapore, Dubai, Bangkok, UK, Germany, Belgium and Australia. In addition, the C-17 and IL-76 aircraft have been tasked to airlift cryogenic oxygen containers, oxygen generators and ventilators from Israel and Singapore. The Navy has also deployed its INS Talbar, Kolkata, Airavat, Kochi, Tabar, Trikand, Jalashwa and Shardul to ferry oxygen containers, cylinders, concentrators and related equipment from friendly foreign countries. The ministry said in the coming days, loading of oxygen containers and other medical supplies has also been planned on INS Tarkash, Shardul and Jalashwa from Doha, Kuwait and Muara in Brunei. Kerala will be under complete lockdown from today till the 16th of this month. The move comes as COVID cases continue to surge in the state. More from our Thiruvananthapuram correspondent.
Only essential services are allowed in these days. Public transport will not be there. Shops selling essential commodities will only be allowed to open till 7:30 p.m. Police passes are compulsory for travel and the online facility for the same will come into effect from today evening. Inter-district travel will not be permitted except for emergencies. Banks will only function on Monday, Wednesday and Friday till 1 p.m. Police are directed to strictly enforce lockdown guidelines. Chief Minister Pinarayi Vijayan assured that the essential services including vaccination center visit will remain uninterrupted. He further said that the free food kit distribution will resume to help the people tied over lockdown and the migrant labourers are also brought under the ambit of the scheme. Meanwhile, presently over 4 lakh active COVID cases are there in Kerala. Mayusha for AR News from Thiruvananthapuram.
Karnataka government has announced a complete lockdown in the state from May the 10th to 24th May. Chief Minister B.S. Yediyurappa announced the decision yesterday after holding review meetings with officials in Bengaluru. He said imposing restrictions is essential in the state as the number of COVID deaths are increasing day by day. According to the guidelines issued by the government, groceries, fruits and vegetable, meat and fish stores will be open from 6 a.m. to 10 a.m. every day. The milk booths and Hopcom's vegetable and fruit outlets will be open from 6 in the morning till 6 in the evening. Eateries can extend parcel service. Takeaway from standalone liquor stores will be allowed between 6 to 10 a.m. Delivery of all items through e-commerce portals and home delivery system will continue. The public and private transport services will remain suspended during the time. Interstate and inter-district movement of passenger vehicles will be allowed only in the case of emergencies. Industries manufacturing essential commodities, production units, and construction projects having on-site workers will be allowed to operate. Maharashtra has reported 54,022 new COVID-19 cases, taking the cumulative total to 49,96,758. Total 37,386 patients were discharged from across the state yesterday. According to the State Public Health Department, 898 people succumbed to the infection. We have more from our Mumbai correspondent.
In Maharashtra, over 1,73 lakh people have been vaccinated so far. In some positive news for Mumbaikars, the city is witnessing slowdown in new COVID-19 cases since last week. Mumbai reported 3,040 new COVID-19 cases, 4,385 recoveries and 71 deaths in the last 24 hours. The city now has 54,162 active cases. The number of sealed buildings has also come down from 1,109 to 728, whereas the number of sealed floors has come down from 10,686 to 9,069. Madhuri Pange, AIR News, Mumbai.
Gujarat recorded 12,064 new cases of COVID-19 yesterday. 13,085 patients recovered in the last 24 hours. We have more from our Ahmedabad correspondent.
Maximum 3,744 new cases of COVID-19 reported from Ahmedabad, while Surat recorded 903 new cases. 119 patients lost their lives yesterday. With this, the death toll due to COVID-19 in the state has reached up to 8,154. Meanwhile, 1,84,659 persons were vaccinated in the state yesterday. Now Gujarat has vaccinated 1,32,14,916 persons till now. Ahmedabad Municipal Corporation has launched a drive-through vaccination center at Sardar Patel Stadium in Naurangpura area from today. Similar drive-through vaccination centers have also been organized in Bhuj and Gandhinagar. Yogesh Pandya, AIR News, Ahmedabad.
Odisha government has made adequate arrangements for uninterrupted supply of oxygen to hospitals in the state. While health institutions in every district in the state have been tagged to one or more oxygen refilling centers, the government yesterday directed the collectors to increase the frequency and number of vehicles used to refill oxygen cylinders so as to ensure its seamless supply. More from our Bhubaneswar correspondent.
While Odisha has been supplying medical oxygen to other states for COVID-19 patients, the state government has also ensured that the hospitals back home are kept oxygen ready, particularly in view of the increasing number of infected cases. On the other hand, the state has also managed to keep the vaccine wastage rate at -2.20% by prudently using the extra dose in each vial as wastage. Meanwhile, the state is now battling with an incremental active case load of COVID-19 patients that now has reached almost 87,000. It is Chandradas, AIR News, Bhubaneswar.
In Chhattisgarh, a unique initiative has been taken by the state government to prevent the spread of COVID-19 infection in rural areas of the state. A free kit of medicines is being made available to people with COVID symptoms in the villages. More from our Raipur correspondent.
In the rural areas of Chhattisgarh, the health department has so far provided medicine kits to about 7 lakh people who have symptoms of corona infection. This kit contains medicines that are usually given to COVID patients. Chief Minister Bhupesh Baghel applauded the role of health workers and Mitanin in containing the spread of corona infection in rural areas. This initiative to provide medicine kit free of cost to the persons with COVID-19 symptoms has led to desired results in some districts including capital Raipur and Durg. These districts are showing early sign of reduction in COVID-19 cases. Vikalp Shukla, AIR News, Raipur.
In Bihar, COVID-19 has spread in rural areas. Additional Chief Secretary, Panchayati Raj Department, Amrit Lal Meena said 30% of the households in rural areas are members having fever. State government has instructed all mukhias in the vulnerable districts having a higher caseload to track symptomatic patients and ensure they are put on early medication after proper tests so that complications and mortality rate is reduced. After recovering successfully from COVID-19, Uttar Pradesh Chief Minister Yogi Adityanath will visit Bareilly and Muradabad districts today and review the arrangements for COVID patients in these districts. This is his first visit outside Lucknow amidst the second wave of COVID-19. The severity of COVID infection in the state seems to be declining day by day.
Shiromani Gurudwara Prabandhak Committee, SGPC, has decided to set up oxygen plant as well as to provide services through oxygen concentrators for the treatment of COVID-19 patients. The president of Shiromani Gurudwara Prabandhak Committee, Bibi Jagir Kaur, said the SGPC is setting up an oxygen plant at Shri Guru Ramdas Medical College in Amritsar, which will start working within a week. In Ladakh, the recovery rate from COVID-19 has improved to 90%. The number of recovered patients outnumbered the new cases. This is much above the national average of recovery. Leh district is under 80 hours of lockdown since Thursday night from 9 p.m. till Monday morning 5 a.m. Kargil district is observing night curfew since yesterday. A report from our Leh correspondent. I beg your pardon, we do not have this report. We move on to the next news item. Calcutta High Court has asked West Bengal government to file an affidavit within 3 days, apprising it of the present law and order situation following the post-poll violence. A 5-judge bench of the High Court directed the state government to specify in the affidavit the names of areas where violence had broken out. It also asked the state government to list the steps taken to prevent or control the violence. The apex court was hearing a PIL that claimed the life and liberty of people are in danger in West Bengal due to unchecked post-poll violence. The PIL was filed by Anindya Sundar Das, who is also a lawyer. He has claimed in his plea that the lives of people were in danger owing to the alleged inaction of the state police force. The High Court will take up the matter again on 10th. West Bengal Chief Minister Mamata Banerjee had said that 16 people have lost their lives in post-poll violence so far.
The central leadership of the BJP has told Assam Chief Minister Sarbananda Sonowal and Senior Minister Hemanta Biswa Sharma to reach Delhi today. Both of them will meet party's President JP Nadda. The issue of next Chief Minister in Assam is expected to be discussed today. Though the BJP with its allies retain power in Assam, the party is yet to declare the name of the next Chief Minister of the state. Along with Sonowal, the name of Hemanta Biswa Sharma is also being discussed as the next Chief Minister of the state. Villagers in cold, arid region of Ladakh are becoming innovative. With the increased access to knowledge, especially from media like All India Radio in their native language, Liktse village is growing horticulture nurseries. At an altitude of over 15,000 feet in Changtang region, Liktse is an oasis in cold desert. All India Radio Leh is celebrating 50 years of its service in June this year. Our Leh correspondent has filed a special story from Changtang region.
A 70-kilometer away on the Leh to Nyoma road in Rongchurgut, which translates to water flow in a valley, Liktse is relatively warmer place in Changtang region where temperature go as below as -30 degrees Celsius. A villager Ngawang Riksin says the villagers prefer listening to All India Radio for news and entertainment.
हम रेडियो प्रोग्राम हर वक्त सुनते हैं तो न्यूज सुनते तो हमें अभी देश में ये बीमारी फैल है तो हमें जरूरी समझ के हम सुनते हैं कि हमें अगर अचानक इमरजेंसी में कुछ भी हो सकता है। रेडियो में बोलते हैं प्रधानमंत्री जी बहुत ख्याल रखकर हमें बहुत देखभाल करते हैं और उन्होंने हमें दवाई के बारे में तो हम उनसे दिल खुश होता है।
As they realized weather condition in Liktse suits for horticulture crop, with the help of horticulture department and research organizations like Bihar and SCOST, the villagers are now growing horticulture siblings like apple, apricot, walnut, etc. in a nursery. As others are learning the trade from Ngawang Ritsin, villagers Changtang are rewriting their fate with confidence. This is Diskit Dolma from Leh Ladakh.
In sports, Indian wrestler Seema Bisla has secured a Tokyo Olympics berth in women's 50 kilogram after reaching the finals of the World Olympic qualifier at Sofia in Bulgaria yesterday. Seema becomes the fourth woman and eighth overall wrestler to qualify for the quadrennial event. With this, India equals its previous best qualification of 8 wrestlers from the 2016 Olympics.
6 times IBA Women's World Champion and 5 times Asian Women's Champion Mary Kom will compete in the flyweight 51 kg in Dubai in the upcoming Asian Women's Boxing Championships. The upcoming ASBC Asian Men's and Women's Boxing Championships, which are scheduled to be held in New Delhi, have been relocated to Dubai, United Arab Emirates, due to the current COVID-19 situation. Indian boxer Mary Kom, who is an Asian Games winner and Commonwealth Games gold medalist, will start the tournament as favourite in the women's category. Among the defending IBA Men's Elite World Champion, Uzbekistan's trio Shakobuddin Zoirov, Mirazizbek, Mirza Khalilov and Bakhodir Jalov. Furthermore, Kazakhstan Beksard Nirdalov will be there in Dubai. IBA Women's World Champions Philippines' Nesty Peticio is also planning to attend.
And now let us take a look at the weather forecast for today. National capital Delhi is expected to have clear sky. Minimum temperature was recorded at 24 degrees Celsius, while maximum will be around 39 degrees. In Jammu, minimum temperature was 23 degrees Celsius, while the maximum will be around 35 with partly cloudy sky. Srinagar had minimum of 12 degrees Celsius and maximum will be around 23 degrees. The city will have partly cloudy sky with possibility of rain or thunderstorm. In Leh, temperature will hover between 6 and 20 degrees Celsius. The sky will be generally cloudy with a possibility of light rain or drizzle. In Gilgit, the sky will be partly cloudy. Minimum temperature was 12 degrees and the maximum will be around 30. In Muzaffarabad, temperature will shift from 11 degrees in the morning to around 32 degrees Celsius in the afternoon. The city will have partly cloudy sky. Mumbai will have partly cloudy sky. Minimum temperature was 27 degrees Celsius and the maximum will be around 35 degrees. Chennai may witness thunderstorm with rain. The minimum temperature was recorded at 29 degrees Celsius and the maximum is expected at 35 degrees. In Kolkata, there will be partly cloudy sky with possibility of moderate rain. Minimum temperature was 25 degrees Celsius, while maximum will be around 36 degrees.
And now an overview of today's newspapers. Over 15% positivity in 24 states, cases trending steeply up in 30 districts is the headline in the Indian Express. Second wave spreading much faster in rural India than first, headlines the Hindustan Times. Corona invades rural India with vengeance, highlights a pioneer. Business Standard and Hindu Business Line quote the Finance Ministry are saying that the second wave is a downside risk in Q1. The Asian Age highlight Chief Scientific Advisor as saying that the third wave can be handled if stringent right steps are taken. Not just vaccines, India seeks patent waiver for COVID medicines too, reports the Times of India. And finally, WhatsApp won't delete account over privacy policy, reports the Times of India.
And now, before we end the bulletin, the headlines once again. Prime Minister Narendra Modi to participate in meeting of European Council today as a special invitee. Government to induct 8 lakh qualified Ayush professionals for clinical management of COVID-19. India says TRIPS waiver will enable rapid scaling up of manufacture and timely availability of affordable COVID-19 vaccines. Indian Air Force and Navy step up efforts to ferry oxygen and medical supplies. Calcutta High Court seeks report from West Bengal government over post-poll violence. US calls upon WHO to invite Taiwan for upcoming World Health Assembly as an observer. And in sports, Indian wrestler Seema Bisla qualifies for Tokyo Olympics. For details of these stories and more, log on to our website www.newsonair.com and News on AIR app. And with that, we end the morning news. Have a nice day.